The mission of OffSite Care is to bring the best specialty care available to any patient anywhere. For example, if there's a patient in Willits, California who has a severe spine infection and they have no infectious disease specialist in that area, and I get a call, I see the patient by robotic telemetry, I arrange to get a very qualified infectious disease consultant to help out on this case, and they can keep the patient there and treat with antibiotics we can suggest, oversee, as opposed to having the patient transferred to San Francisco, which is about 150 miles away. So that our goal is to keep patients at home with specialty care as long as that's their best course. If the best course is to move the patient to a larger university center of excellence, we'll be the first to do it. But if in our judgment we can give good care at home using an intensivist and 6 subspecialists, we'll try to keep that patient at home in his or her hospital, in his or her intensive care unit, for we think the best available care.
Hi, I'm Jim Russell, the CEO of Palm Drive Hospital. I've been asked to speak to our hospital's mission. And in our hospital mission statement, it says that Palm Drive exists to deliver access to quality and compassionate health care. But for us, thanks to Dr. Good and the robotic telemetry assisted ICU, what it really comes down to is that we exist to deliver time-sensitive access to critical care for our citizens. It's not an exaggeration to say that at least 3 of our citizens will be alive next year thanks to robotic-assisted capability. These are patients that would not survive the extra 20 to 30 minutes it would take to get them to an urban hospital further to the east. Consequently, our motto, saving lives 24/7, is not a claim, it's a fact. And so we look forward to having the William Heberden Robotics School of Telemedicine here at the hospital in this coming year.
We've been on the books for 2 years and in hospital for 1 year. We started just about a year ago. In fact, we had an anniversary. We opened the intensive care unit in this hospital, which is the Palm Drive Hospital in Sebastopol, California, on July 6th, 2007. We had our anniversary. And we celebrated the anniversary with a meeting of the whole hospital staff. And we point out to the staff that the ICU, in opening July 6th of last year, has essentially saved the hospital $800,000. And we provided excellent care. And we actually think we've saved 5 people over the last year who wouldn't have made it otherwise because they were so ill. If they'd have been in an ambulance going someplace else, without the interventions that we were able to do here, we don't think they'd have survived. So we think we made a difference in terms of lives saved and in terms of monetary impact in terms of this hospital in Sebastopol.
Hi, my name's Lori Austin. I'm the Chief Operating Officer at Palm Drive Hospital. And I have been here since Dr. Good brought the robotic system to the hospital. And what that's done for us is it's allowed the local physicians to keep the patients locally. Beforehand, we would have had to have shipped them to a larger city or to one of the other facilities, and we would have lost access to their patients, would have lost access for the families to visit their patients. So the robotic telemetry system has brought the specialists to the hospital, specialists we would have never had available to us in the past. And with that, that's brought confidence to the local physicians in keeping their patients also, and the community's confidence level has grown quite a bit. We're able to bring a level of high-scale medicine to the hospital that has only been available in the large cities in the past. It has brought a mobility of these specialists to the various units. For example, in the past, we wouldn't have had any specialists, but now we have the specialists both to the med-surg units, to the ICU, and to the ER. Some of the other systems are fixed and they focus in just on one bed, but this, with the robot, is able to go anywhere. So for a smaller hospital, it's been much more functional and much more utilitarian in our needs. 1 year ago, we were looking to close the hospital, and by having the specialist available to us here, it's been able to allow us to stay open and to keep the patients within our facility. And as a matter of fact, we've had patients transferred to us because we've had the specialists available that nobody else did. It's been a great asset to us, both for the community and for the hospital, and staying in business.
Hi, my name's Karen Reese. I'm the Chief Nursing Officer here at Palm Drive Hospital. I'd just like to say a couple words about the nursing care that we deliver here with the help of the robot. You know, we all know that patients come to the hospital for nursing care, and Herb, the robot, has really revolutionized nursing care for patients. And our nurses have become very comfortable using the robot in the delivery of care. And one of the things that have really changed and impacted the nursing delivery here is the fact that we have the specialists available instantaneously for our patients when they need it. And in the old model, you might have to wait, you know, several hours and even sometimes a day or so, which delays the impact of the care for patients. Our nurses are very comfortable with the robot, and one thing we look forward to doing here at Palm Drive is showing future hospitals how you can integrate the robot into the care at the point of service. So to us here, for the nurses, Herb is not a robot. He embodies many different specialty services that helps us here.
OffSite Care has been able to help patients and hospitals in these ways. The patients are helped because they get better care, and they can stay at home as long as it's safe to be at home and reasonable. The hospitals benefit because they have a census, and the census is the key to economic survival. But the hospitals also, in doing this, develop a sense of pride, develop a sense of adventure because they're doing something new. We are doing this as really a forerunner in the United States. I was at a conference in Santa Barbara for robotic telemetry 2 weeks ago, and what we're doing is really being done only in one other place in the United States, in Boise, Idaho. And we're doing it differently. And what we're trying to do is, I'll say uniquely American, we're trying to do this in such a way it'll pay for itself. I really don't depend upon grants, upon fees in general, and my goal is to make this economically self-standing so it can replicate with a certain profit and benefit, not being a burden to anybody, and that's my goal.